Bile acid malabsorption. Bile acid malabsorption, also known as bile acid diarrhea, is a disorder in which excess bile acids enter the colon due to impaired reabsorption in the terminal ileum. This stimulates secretion and motility, resulting in chronic watery diarrhea. It is often under-recognized and misdiagnosed as irritable bowel syndrome with diarrhea. The peak age of onset varies by bile acid malabsorption subtype. Type 1, secondary to ileal disease or resection, typically presents between 20 and 30 years of age. Type 2, idiopathic or spontaneous. This is more common in those aged 40 to 60 years old. Type 3, associated with other gastrointestinal disease, can occur at any age depending on the underlying condition. Pathophysiology. Bile acids are synthesized in the liver and secreted into the duodenum to aid fat digestion. In the terminal ileum, approximately 95% of bile acids are normally reabsorbed and recycled, enterohepatic circulation. If this process is disrupted, for example due to ileal resection, inflammation, or idiopathically, excess bile acids spill into the colon. Bile acids in the colon stimulate chloride and water secretion and increase motility, resulting in chronic diarrhea. The liver responds by increasing bile acid synthesis, which can be monitored via serum markers. Symptoms. Chronic watery diarrhea, this is the most common presentation, may occur intermittently or postprandially. Severe cases can result in fecal urgency and incontinence. Abdominal pain or cramping. Excess flatulence and bloating. Weight loss, particularly in long-standing or untreated cases. Signs. Often non-specific. Abdominal distension may be present. Clinical examination is usually unremarkable unless there is an underlying disease such as Crohn's. Diagnosis. Clinical history is key, especially in patients with chronic diarrhea unresponsive to dietary/lifestyle changes, and prior terminal ileal resection, radiotherapy, or Crohn's disease. Diagnostic tests. SEHCAT 75 selenium homocholic acid taurine retention test. This is gold standard. This measures bile acid retention after oral ingestion of a radio-labeled bile acid. Retention less than 15% at 7 days indicates bile acid malabsorption. Serum 7A hydroxy 4-cholesten 3,1, also known as C4. Elevated C4 reflects increased hepatic bile acid synthesis. This can be supportive in centers without access to SEHCAT. Fecal bile acid measurement. This is rarely used due to limited availability and practicality. Complications. Reduced quality of life due to unpredictable and socially limiting diarrhea. Weight loss in severe or untreated cases. Fat-soluble vitamin deficiencies, ADEK, and malabsorption of other nutrients in prolonged or severe bile acid malabsorption. Management. Lifestyle modifications. Low-fat diet, typically less than 40 grams per day. This is to reduce bile acid secretion and symptom severity. Medical treatment. Bile acid sequestrants, first-line therapy. Cholecysthyramine, cholestyramine, or cholecyvelum bind bile acids in the gut, reducing their irritant effect in the colon. Must be taken with meals, may cause bloating, nausea, or interference with absorption of other medications. Addressing underlying causes. Optimize treatments for Crohn's disease or other underlying GI disorders. Consider referral for small bowel imaging if undiagnosed ileal pathology is suspected. Monitoring and follow-up. Review response to treatment and adjust dose as required. Monitor weight, vitamin levels, and symptom burden. Long-term use of bile acid sequestrants may require supplementation of fat-soluble vitamins.
That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today